This presentation is from SRM Dental College, Ramapuram, Department of Pharmacology. So I am Dr. Vinodini, going to explain about the mechanism of action of first-line anti-tubercular drugs. So Mycobacterium tuberculosis. Mycobacterium tuberculosis is the causative organism which causes tuberculosis infection, which is affecting millions of people and causing deaths in lakhs over worldwide. So this Mycobacterium tuberculosis is an acid-fast bacilli and is of rod shape. And how it is able to spread, it is, even though the primary organ which is being affected by Mycobacterium tuberculosis is lungs, almost all the other organs are also getting affected, and predominantly there are many features that are present in this organism that is able to provide an anchorage to the organs wherever it is invading, and it is able to affect the people. So how we are going to treat this Mycobacterium tuberculosis? There are many drugs that are being available to treat the Mycobacterium tuberculosis, and so first line drugs. What are these first line drugs? First line drugs are very specific against the Mycobacterium tuberculosis, and they have low toxicity when compared to the other drugs which are being used in the treatment of tuberculosis. So what are these first line drugs that are being used? Only 4 drugs are being approved and are being used as first line drugs, and the drugs are isoniazid, rifampin, pyrazinamide, ethambutyl. So again, isoniazid has been represented by the symbol H, and rifampin R, pyrazinamide Z, ethambutyl E. So how these drugs are going to affect or going to kill the Mycobacterium tuberculosis is what we are going to discuss in this presentation. So the first drug, isoniazid, how it is going to act. This is Mycobacterium tuberculosis transverse section. So we can see the cell wall here. This cell wall is being again protected by a waxy coat called as mycolic acid. So we can see the mycolic acid here, the thick surface, which is thick structure which is actually covering, is called as the mycolic acid. This mycolic acid is actually produced by the gene, synthesized inside the Mycobacterium tuberculosis by a gene called as INHA gene. So this INHA gene is responsible for the many conversion reactions, and finally it produces the mycolic acid. So this mycolic acid is providing the waxy coat. So when we introduce the drug isoniazid, our first line drug isoniazid, it enters the Mycobacterium tuberculosis by passive diffusion. So after entering the mycobacteria, our INH is getting converted by an enzyme called as catalase reductase and encoded by the gene CATG. So this CATG gene converts INH into the active metabolite. So the active metabolite of INH combines with the NAD, which is present inside the mycobacteria. So this combination product produces an adduct. So this adduct, which is being formed by the combination of INH and INH plus and NAD, inhibits the enzyme INHA gene, is inhibited by the adduct. So once the INHA gene is inhibited, there is no synthesis of mycolic acid, and it causes disruption of cell wall synthesis. So in addition to INHA gene, CASG gene is also to a certain extent being inhibited by this adduct. And the cell wall synthesis, what happens when the cell wall synthesis is inhibited? So there is leakage of the cell contents and leading to the lysis of the bacteria, mycobacteria, leading to the bactericidal effect of isoniazid. Isoniazid has a very specific binding point, so it does not act on any other mycobacteria. The next drug what we are going to see is rifampin, represented by the letter R. So this is again the mycobacterial cell wall. Inside the mycobacterial cell wall, we can see the synthesis of DNA. How DNA synthesis is taking place. So whenever there is separation of the coding strand and the template strand, the mRNA, messenger RNA, which is present inside, has to provide the information that has to be transcribed to the DNA. The new strand DNA has to get the information from the mRNA, and the whole set of process occurs when they cross the RNA polymerase enzyme. So this RNA polymerase enzyme is a DNA dependent RNA polymerase enzyme. So the whole setup, once it enters, leads to the synthesis of mRNA, and which again leads to the synthesis of DNA. So this is what normally happening in the mycobacteria. What happens when we give our drug rifampin? Rifampin again enters the mycobacteria via passive diffusion. So after entering, it just go and bind with the DNA dependent RNA polymerase. So after binding, what it causes? It causes an conformational change in the RNA polymerase enzyme. So because of the conformational change in the RNA polymerase enzyme, the normal mRNA synthesis which has to be taken place does not happen here. So leading to the absence of DNA synthesis. So that is leading to the bactericidal effect of rifampin. So since no DNA synthesis, it is causing bactericidal effect. So our third drug which we are going to discuss is pyrazinamide, represented by the letter Z. There are many postulated mechanisms for pyrazinamide. We will discuss in the next slide. So again, cell wall structure. So when pyrazinamide, represented abbreviated as PZA, when it is introduced into the patient, given to the patient, it enters the mycobacteria via passive diffusion. So after entering, by the PNCA enzyme which is present, it gets converted to pyrazinoic acid. The pyrazinoic acid is an active radical, but the pyrazinoic, after forming pyrazinoic acid, some of the pyrazinoic acid get escaped outside the bacteria by the defective efflux pump that is present in the surface of the mycobacteria. So after entering the gone out of the structure, it again binds with H plus radical outside, and it forms an HPOA radical. So this HPO radical again enters the mycobacteria via passive diffusion. So the formed again gets detached. The HPO again gets detached to POA minus and H plus radical. So the formed PO, the already available pyrazinoic acid, and the partial thing that has already entered via the active radical HPOA minus radical forms produces three different types of mechanism. They act by inhibiting NAD metabolism. So there are some changes that are being evident with the NAD metabolism due to the action of pyrazinoic acid. Next thing is, it also causes membrane function disruption, again to some extent inhibiting the cell wall synthesis. So the next postulated mechanism is, it also inhibits fatty acid synthesis by inhibiting the fatty acid synthase 1 enzyme. So these are the three mechanisms by which pyrazinamide is able to act inside the Mycobacterium tuberculosis. The next drug is ethambutyl, represented by the letter E, and it is a static drug. This drug produces bacterial So mycobacteria, a thick cell wall. Again, this drug, what is happening normally? Cell wall synthesis is being mediated by different materials inside the mycobacteria. So one of the ways by which cell wall is being synthesized is by the arabinol transferase enzyme. So this arabinosyl transferase enzyme, which is present inside the mycobacteria, helps in the transport of arabinose sugar. So after transporting the arabinose sugar, it gets accumulated and it leads to the next step, that is the polymerization of arabinoglycan. See, the polymerization of arabinoglycan forms a complex structure leading to the synthesis of cell wall. So the one mechanism by which cell wall is being synthesized is by this. So the polymerization of arabinoglycan causes cell wall synthesis. So what happens when we give our drug? So when ethambutyl is introduced, after it enters the mycobacteria, it goes and inhibits the enzyme arabinosyl transferase. So what happens when arabinosyl transferase is inhibited? So there is no transport of arabinose sugar and the polymerization of arabinoglycan does not take place. Since there is no polymerization of arabinoglycan, there is no cell wall synthesis. So it's again being a static drug because there are other mechanisms by which cell wall to some extent can be synthesized. Okay.